So COVID-19, so much content. And that's the thing that we find is we are just over consumers of content. So everything on the Wealth Edit behind the membership wall, we want people to consume slowly because that's what works in real life. Outside of the Wealth Edit, we have a private practice called Somerset Advisory where we, direct private clients on their wealth. But there's this gap that we see, particularly for women in the South, where we just don't want to talk about money, don't want to do these things. And there's so much content everywhere on the internet that it's hard to find a true source, a true voice. And so that's sort of where we are. But I think that's right now, there's so much information on COVID-19 that it's hard to find a true north. And so I don't know if you found, this is a fairly well-read audience. We understand the benefits of social distancing. Emily and I have to work together, so we are using hand sanitizer and not coughing on each other. But generally speaking, most of the people on this call are staying at home and have been for the good part of a month. So I guess to speak to that first, and then I want to ask you some questions specifically about Alabama.
Yeah. So one thing I will say, considering that background, is that Twitter has been a phenomenal source for me for getting information that comes straight from the source. So I started learning about SARS-CoV-2, which is the virus that causes COVID-19, and the disease COVID-19 back in, I'd say, early January, maybe even late December. And it came from following Stat News, S-T-A-T. Helen Braswell is a writer, a scientific writer for Stat, and she was one of the first to break the news about this really odd virus that was circulating in Wuhan and starting to trickle out of China, out of Wuhan into other parts of China. And follow a lot of colleagues who are based at Boston University, Harvard University, Johns Hopkins, who were noticing similar things and starting to kind of follow the data, right? And so I feel like, we didn't really start to hear about this from CDC and World Health Organization until in mainstream, possibly late January, maybe early February. But because I already had knowledge about it, covered it as early as January 26th, I think it was the date that my first blog post arrived. And in that time, had conversations with my husband, because obviously things like this don't necessarily just have an impact for people's health. As you know, it has an impact for people's finances and so forth. And so we very early had conversations about watching the market and refinancing if the rates dropped low enough, for example. We were prepared because he works in a retail environment. And so we were preparing, I should say, in case he was not going to be able to work. And so that financially, if it so happened, and it did happen, that people had to reduce their workload, that we would be financially okay, right? For at least 3 months, which is the common advice that you get, right? And so I would say that Twitter has been a great source for that. I read a lot of journal articles. And so the New England Journal of Medicine, the Journal of the American Medical Association, or JAMA, Science Magazine, The Economist. These are all places where you can get sort of breaking news about things that you should start to watch for. And, and recognize how those things might affect every aspect of your life. And so we were, my husband and I, very cautious very early on in trying to prepare for this. And thankfully that preparedness paid off. In some of my earlier blog posts, I did center a lot of the messaging, because what we were learning was that only older individuals seem to be mostly affected by COVID-19. We're seeing not quite the same trend in the US. We're seeing that younger people are also being hospitalized and affected. But early on in my blog post, I said, if you're older, please consider, not stockpiling necessarily, but preparing yourself in case you're unable to leave your home. And that was the same advice that I gave to my parents who continue to live in Los Angeles and his parents who live in Wisconsin. And they're both grateful that they were prepared before things started to run out in grocery stores.
Yeah, that's a really good word.